Hi, I'm Jacqueline Walker. I'm the dietetic lead here in Moray, which is in Grampian in Scotland. And I'm also the professional advisor at Scottish Government on the Diet and Healthy Weight team. So a little bit about me and my background. I started off as a student of Robert Gordon's in 1987, and then went on to have my first job in the Ayrshire and Arran Health Board as a junior dietitian. In that role, I saw the need to do some audits. And so the audits that I started in Ayrshire led on to a national audit, nutritional audit of nutrition in the elderly. And because of the national audit, the Scottish Government identified the need for food, fluid, and nutritional care standards in hospitals. So I was involved in the development of those standards and the reviewing of them across Scottish health boards. I moved in 2000 to NHS Tayside, where I was really lucky to work in public health, and that's where I've been working for the last 20 years, or I was 20 years in public health. Taken forward with Joyce Thompson, who's also an Elsie Widdowson lecturer, a managed clinical network for nutrition, and that led to a number of transformation activities across Tayside. Some of those activities were so successful that they were identified as requiring us to really take them across and roll them out across Scotland. So I'm delighted that some of that work, including the gluten-free food service across Scotland, has been rolled out across Scotland and is still very successful today. Some of that national work led the Scottish Government to ask me to be the lead clinician for celiac disease and modernising patient pathways. So really honoured in 2016 to do that and really taken a dietetic leadership approach to celiac disease and a public health healthcare approach to celiac disease in Scotland. I was also the professional advisor on that modernising patient pathway for IBS and IBD, and again some really good transformation came out of both of those pathways. I then moved to be a professional advisor in the Diet and Healthy Weight team, and that's where I still am. I work part-time for Scottish Government and part-time for NHS Grampian. And my role there, along with my colleague Laurie Isles, is to provide the dietetic leadership on the type 2 diabetes prevention, early detection and early intervention framework for the Scottish Government. And again, that is leading to some huge transformational change in Scotland. I'm now working and really honoured to be working in Moray as a dietetic lead. I started that job last October in 2022 and really enjoying that mix again of being involved in government and in the service. So that's a little bit about me, and delighted to be presenting the Elsie Widdowson Lecture this year. I feel absolutely honoured to be doing this for the BDA. I met Elsie Widdowson once at Glasgow when I was doing my MSc at Glasgow University, and I was so impressed with the work that she did as a dietitian, and I'm just absolutely delighted to be able to do that this year. And I just feel that I'm following in some other huge footsteps of other Elsie Widdowson Memorial Lecture people that are just delighted. So why is it in every member's interest to learn about public health, and particularly about a healthcare public health approach? Well, I think it now in 2023, it's so important. It's always been important, but I think it's now more important than ever. We've got increasing policy from both the UK governments and Scottish governments, and I'm sure Welsh and Irish governments as well, about taking forward that public health approach in reducing inequalities, focusing more on prevention. And I think as dietitians, we could be at the forefront of that. We've also got our HCPC registration that is now stating that we really have to take that public health approach. But for me, living in Scotland, I'm seeing widening health-related and nutrition-related inequalities. And I think we really need, as dietitians, to step up and do more to tackle that. We've got increasing morbidity and mortality related to nutrition-related diseases. And we've got a potentially reducing financial envelope. We've got to make best use of the finances that we've got in the NHS to meet and realign these finances to meet the most in need. So what can members expect to gain from my Elsie Widdowson Memorial Lecture? Well, you'll get an understanding of what healthcare public health is. I mean, healthcare public health is one of 3 core domains of specialist healthcare practice, alongside health improvement and health protection, which is probably more what you've been used to hearing about in terms of public health. Healthcare public health itself is really concerned with, really maximising the population benefits of healthcare. So what we deliver as dietitians, mainly the majority of dietitians are involved in healthcare, while meeting the needs of individuals and groups, really looking at how we can prioritise the available resources that we have within dietetics and the health service, and how we can, if possible, prevent diseases, although we know that not all diseases can be prevented. But we can detect them early, and we can take early interventions, and we can really help people support living healthier lives. So taking a secondary prevention approach. And we can improve health-related outcomes through designing better pathways of care, improving the access of care to our dietetic services, utilising and evaluating our dietetic services to make sure that they are effective and efficient, and that they really create appropriate dietetic and healthcare interventions that meet the population need, particularly those that are most in need, and focusing very much on how we can reduce the widening nutrition-related health inequalities. So what are the 3 takeaways from my lecture? I hope that people would go away thinking that they can do healthcare public health. We'll go and do a little more digging around what healthcare public health approaches are and how it is relevant to clinical dietetics, how we can, as dietitians, hold a mirror up to ourselves, because most dietitians will be doing some element of public health, and healthcare public health is just about holding a mirror up and saying, what more can we do? So that's the first take-home message, is that what more can we do as dietitians to really drive that healthcare public health approach? The second is, and I will be speaking about efficient ways of working. And in my lecture, I will be speaking about digital. I am one of the digital leaders in Scotland. And I think I will hopefully encourage dietitians to really embrace the digital way of working. We very much work in a face-to-face, person-to-person way, or we have done in my dietetic career. That was the norm. But even before COVID, but very much through COVID and since COVID, we're learning to do things differently. And so I'll speak a little bit about digital and about how we could embrace digital, and how digital will help us reduce those widening inequalities, and speak about that. And also how digital helps us to be sustainable and reduce CO2, which of course was last year's Elsie Widdowson Lecture. And the third takeaway message will be how we can focus on reducing health inequalities. That's a very key driver for healthcare public health. And it's something that I think as dietitians we can do a lot more on. We can be looking at our practice and asking the question of who's not coming to our clinics, who comes once and then DNAs, who are the people that are most in need, and why are they not being referred? There's lots we can do as dietitians to really focus on health inequalities. And so my very third and very important takeaway message will be about how we as dietitians can focus on reducing health inequalities. So I'm really looking forward to seeing you all at the British Dietetic Association's AGM on the 19th of September and undertaking my Elsie Widdowson Memorial Lecture on healthcare public health in dietetics. I'll see you then.